Hi everyone. One of the challenging topics that Year 2 students face is how to read ECGs, especially during exams. So today I will give you a systematic way to report your ECG findings. So start with the patient's name, age, and gender, then the chief complaint. After that, report your general findings. This includes rate, rhythm, and axis deviation, and after that your specific findings, and basically for this just follow the same order of the segments and the waves in the ECG. So if you get this ECG, for example, the first thing I want to report is basically the patient's ID. So Mr. X is a 35-year-old male presented with chief complaint of chest pain. Then identify the rate. So count the number of QRS complexes in lead 2 here. This is 10 seconds, and if you multiply the number of QRS complexes by 6, you will get the beats per minute. So here you can see that it's 12 multiplied by 6, and you will get 72 beats per minute. For rhythm, just find if it's regular or irregular. So if you find the spaces between QRS complexes are always the same, you know this is a regular rhythm. And then if there's a P wave before every QRS complex, you know this is a sinus rhythm. Otherwise, it will be non-sinus rhythm. So this is a regular sinus rhythm. Then for axis deviation, you just want to focus on two leads, lead 1 and lead 2. If QRS complexes in both leads are positive, this is normal axis. If it's negative in lead 1 and positive in lead 2, as if they are pointing towards each other, as if they are shaking hands, and you shake hands with your right hand, so this is right axis deviation. If it's positive in lead 1 and negative in lead 2, as if they are pointing away from each other, this is left axis deviation. Now for specific findings, follow the same order of waves and segments in the ECG. So start with the P wave and PR interval. The PR interval is the space between the beginning of P wave till the beginning of a QRS complex, and this shouldn't exceed one big box. If it exceeds that, then think about type 1 AV block. Then for QRS interval, report if there are any pathologic Q waves, if it's monomorphic or polymorphic, and the width of the QRS complexes. QRS, so 3 letters, and that's why it shouldn't exceed 3 small boxes. Now for ST segment, report if there's any ST depression or elevation and in what leads. QT interval is the space between the beginning of Q wave till the end of T wave, and to identify if this is prolonged or not, find the space between QRS complexes, or what we call RR interval, and then find the halfway point. If T wave ends before that, then this is not prolonged. So QT interval is not prolonged in this ECG. Then for T wave, report if there's any flat T wave, peak T wave, or T wave inversion, and in what leads. Finally, other findings like U wave, right middle branch block, or left middle branch block. And this concludes this video.